Doctors of Reddit, what was a symptom a patient didn't mention that was really important? I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. This is terrifying. Holy crap. A few months ago a woman, 36-year-old, consulted to endocrinology because she was getting fat without a change in her diet and she felt different. Asking more questions, she casually mentioned she hadn't had her menstruation for months and that maybe she was menopausic. At 36, we suggested that she might be pregnant and she said it was a stupid idea and that she knew she was not pregnant. We did some analysis and an echography and yep, 35 weeks pregnant. You give birth at around 40. I'm a doctor. Back in school I had a patient who was a drinker, wasn't feeling great and wasn't sleeping well lately. Asked him how the drinking issue was going and he said he lost the taste for it. Alcoholics can quit. They can stop. But they don't just lose the taste for it. Cancer. Black stools. Folks, if you're having black poops FFS, mention that sooner rather than later. That lady has been seeing nothing but black for months before she thought to mention anything. We found several gastric ulcers and a hemoglobin level that circled a drain. But also mention if you're taking any iron supplements or Pepto. They can cause alarmingly dark stools as well, but in that case it's harmless. Medical intern here. Had a woman come to her complaining about stomach pain. Took her full history, did the exam and vitals. She seemed fine. Mild fever. Made a preliminary diagnosis of gastroenteritis and presented to my doctor. My doctor, who is female, goes to her and asks why she came to her for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did. She said it was fine, and I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy and possibly surgery. Bro, as someone with Crohn's I talk about my crap like an epic. I have the whole Iliad of the story of my bowels down. I had a patient whose main complaint was a wrist sprain. Asked how he fell and he said he felt lightheaded and fell down the stairs. After about 15 minutes of questions about his heart and other stuff, I ask him if he's had any vomiting. He said he vomits every day. I ask if it's red and he said it's bright red every time. The kicker is this was his usual yearly appointment. Dude was vomiting blood every day and not only did not go to the ER, he didn't feel it was worth mentioning at his checkup. I had a patient who needed a small sterile procedure done but had a latex allergy and it was in bright red all over her chart. We used paper charts back then. We had just ran out of latex-free sterile gloves. I went in to tell her she needed to come back in a week when we got them back. Then I decided to ask what happened when she came in contact with latex. Her response, I get chlamydia. Did my sub in a level 1 trauma ED a few years ago as a 4th year med student. Homeless guy with hep, and HIV came in talking about a rash on his shoulder, how it hurt, had been pretty hot out and that was where he was slinging his bag on. Looked okay, figured it for a sweat rash. He was really in there for food, so was going to give him some cream and a sandwich and send him out the door. Was about to leave when I looked at his chief complaint again and it also had testicular pain. So I asked him what was going on with his testicles. Lifts up the gown, and he has a tracking abscess through his scrotal skin and through one of his testicles. It was like a worm burrowing through his balls like it was an apple. Oh, it's okay I guess. Ended up calling urology and infectious disease, and the guy ended up leaving against medical advice because we were making him NPO, without food, in anticipation of surgery. I'm a med student and on my family medicine rotation I was sent to see this woman before the doctor and get a history and physical. She was saying she was having heartburn and just wanted us to give her something to throw up so she will feel better. I thought it was odd and so I went through some more review questions and she said her reflux pain was extending up to the left side of her neck and down her left arm, and that she had been sweating for hours. I cut off the interview short there and went to my teaching doctor to tell him everything and what I thought. Got an EKG. Yep, she was having a heart attack. Had to call an ambulance and get her to the ER. For your entire career, don't forget this case. I'm an doc. All upper gastric pain is an MI until proven otherwise, especially in diabetics and women. Had a guy who was sent in because his family was concerned about him because he was getting into a lot of physical altercations. Appointment with the patient was normal. He was able to talk himself out of most issues his family stated were occurring, and as we were ending he said he had to pick up his other truck from the shop. I then asked, "Oh, you own 2 trucks?" He replied, "I own 5 trucks." The guy was military and only made $60 $70K a year. Come to find out he had bipolar disorder, and in his manic episodes he would take out a large loan to buy a new truck. He had almost $120K in debt in just trucks. If it wasn't for that last part of him mentioning he was getting his truck, I would have sent him home and probably never known he had a psychiatric issue. I'm a doctor. These stories are from a few years ago when I saw patients. I'm a medical intern, working the ED. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed. Procedure in the morning. I'm about to queue up some nitro paste. It's a cream you put on skin that helps get blood flow to the heart. As my resident had seen him first and said it was okay, and I went through the contraindications as it was just habit at this point. One of them is recent Viagra use. Patient had said no to recent Viagra to my resident when his wife was there. He said yes to me when I asked when his wife wasn't there. He wasn't using it with his wife. Nitro paste was avoided. Blood pressure stayed okay. Coronary got stented in the morning, discharged the next day. Pro tip: while you toss the family out to do the rectal exam, ask all the questions they won't answer honestly. Saw a patient during follow-up for a gynecological cancer. She said she felt great. Exam was normal. She was relieved, but she was so anxious it set off my medical spider sense, so to speak. I decided to push a bit further, which led to this conversation. Me: so you said you felt good? Absolutely nothing else bothering you? Her: oh, you know, some small things, nothing having anything to do with this. Me: well, why don't you tell me anyway? Her: well, I kind of have this weird lump on my belly, a sweat gland or a greasy nodule or something. Doesn't really bother me, but I might get a dermatologist to have a look at it if it ever needs to be removed. Me: ah, I see. Could you show it to me? She showed me, and I saw the skin metastasis, clear as day. Don't know how the story ended because I moved to different service immediately after, but if I had to guess, her life expectancy was probably measured in months. Anxious, weird lump, she knew. Admitted a baby my intern year that had transferred to our facility for persistent vomiting following a surgery on a part of the intestinal tract. The transferring facility had wanted us to start the baby on a form of intravenous nutrition and offhandedly mentioned some low-grade laboratory abnormalities that they had attributed to the baby just having had surgery. I go into the room in the middle of the night, the first representative of our medical team to meet the family, and in the process of gathering the history, ask the family what color the baby's poop was. The family replied that it was white or gray and had been since birth and that they just thought that was how it should be. Record scratch. Big red flag. We ultimately diagnosed the baby with a rare genetic disorder that required an organ transplant. If you are a middle-aged plus gentleman and you have cardiac risk factors, diabetes, overweight etc., and you develop erectile dysfunction, you should tell your doctor, as there is some evidence that it is an early symptom of heart disease, possibly preceding a heart attack or stroke by 3 to 5 years. Far better to get on statins and blood pressure medication than just ignoring it or taking Viagra by yourself. You can tell if it's a circulatory cause as opposed to psychological if you stop getting morning erections and have difficult maintaining achieving an erection in your alone fun time. A GP told me this during my primary care rotation. Med student here. I assume she told me this for my learning and not that she thought I was likely an impotent chubby dude. If you are a middle-aged plus gentleman and you have cardiac risk factors, diabetes, overweight etc., and you develop erectile dysfunction. A male redditor told me once that high blood pressure was a good thing because higher pressure equals harder wiener. I tried to convince him otherwise, but he wouldn't listen to me. Always. Dang. Unintentional. Weight loss. Takes me from okay not too bad to oh crap. Such a big red flag. When my grandmother told me about her unintentional weight loss 3 summers ago, I insisted that she see her doctor. I broke down in tears when I got off the phone with her. It turned out to be colorectal cancer and she was gone by Christmas. Not a doctor and not even about me, but this is just too interesting of a story for me not to post it here. So, my dad was a bit of a slow child, always forgetful, got bad grades, needed to have a list of everything important with him all the time to avoid forgetting it. In his 20s he gets an allergy test done for no real particular reason beyond having it recommended to him by his doctor. Turns out he's lactose intolerant. Of course, he tells the doc that the test clearly failed because he's never had a bad reaction to milk in his life. Are you forgetful? Turns out that lactose just makes him forgetful. The doctor he'd visited happened to have done research specifically into that type of lactose intolerance. He cut dairy from his diet and suddenly all the problems went away. To this day I've never met anyone else that even knows that this can happen. I once was rounding on a patient in the morning that had come in for a stroke. I decided to ask some basic review of systems questions just out of habit, and when I asked about changes in vision, he said yes. I probed further and he told me that he was using eye drops for something but that he forgot his eye drops at home 3 days ago when he came to the hospital. For the last 3 days, the vision in his left eye was worsening along with eye pain pressure. When I call his pharmacy to see what drops he was using, as I suspected, they were for glaucoma and he was having worsening vision loss due to untreated glaucoma increasing his intraocular pressure. We got an ophthalmology consult stat. Not a people doctor, but I worked as a vet tech for 3 years. Had a little tiny mini Shih Tzu in horrible health with a nasty attitude to match. You could seriously barely touch the dog and she was very, very sick. The only reason we were able to do anything for her was because she was so small. Owner comes to visit her one afternoon and casually mentions to us that she's deaf. Poor thing was scared out of her mind and did remarkably better once we learned to let her know we were there before touching her. Former tech here, and people really don't want to tell you that their pet ate pot. We don't give a crap if you smoke it and we're not reporting you, but we need to know what your pet ate. I'm an emergency medicine physician. I had an elderly gentleman come in because he fell in his kitchen. Didn't lose consciousness or anything. Didn't have any signs of trauma, but both eyes were slightly swollen, which he said happened before the fall. Oh, and he forgot to tell me, he also had a sore throat. He wouldn't have even brought it up if I hadn't asked why his voice sounded a little muffled. Took a close look at his throat. He had some pretty significant pharyngeal edema. He ended up having what's called angioedema, which explains the throat and eye swelling different from an allergic reaction. He ended up getting intubated and sedated, and went to the ICU to protect his airway. He initially came in because of a completely inconsequential fall, and got intubated and admitted to the ICU because of an oh by the way doc moment. As a primary care doctor, we try to keep to our tight schedules. It can be difficult when patients could come in with something complex or with a shopping list of things they want to talk about, and balancing this with providing good care and being mindful that the next patient will be waiting in 15 minutes for their appointment. We can be notorious for being late for these reasons. I saw a patient the other day who said she had a runny nose. I just got on with it, made sure she didn't have any signs of a more serious illness and gave her some advice on what to do. After that, she also had a pain in her ankle she quickly wanted checked out. I couldn't find much wrong and assured her it would probably be okay in a couple of days. Now her 15 minutes is up and I'm kinda gesturing her that we are finished. Then she pauses and says, okay, I just wanted to get those things checked out. The main reason I'm here is that I've been having chest pain all morning. God, I facepalmed. You have been visited by Reverse Psychology Doggo. Please do not comment and do not subscribe to Updoot Reddit. Thank you for your attention. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.